Well, good morning, everybody. I just wanted to update everybody. The rules are changing as we move. And as you know, Governor Wolf has announced as of June 5th, Montgomery County and Philadelphia County and a lot of the surrounding counties, which includes Elkins Park, is going to go from red to yellow phase. It's about 3 or 4 days. So consequently, we're going to start to reopen our Elkins Park campus, as well as do a little bit more in the Eye Institute, start some of the clinical operations. So during this phase, those faculty and staff that can perform their jobs at home, most of the administrators and a lot of the faculty, they still need to continue to work at home. Those people who absolutely have to be on campus, if you're teaching in a lab or if you're doing some work in an administrative office, then you can come to campus or go to the clinic and do the work that you need to do. But frankly, I don't want you to hang out there. As soon as you're done doing your work, then you need to go back and go home. Your supervisor will be in touch with you to discuss, who's doing what and then when you're expected to return to the facility specifically. If for some reason, maybe health reasons, or you're just not comfortable, you're concerned about coming back to campus or to the clinics, talk to your supervisor and human resources, and we'll work with you to determine if there's some sort of accommodation that could be made in lieu of you coming to work. As you know, as we've said all along, your health and safety and the health and safety of our students remain our utmost concern as we work through all of this. We have adopted all operating protocols based on CDC guidance, and they can be found on our website. It's interesting, when you come to the campus or when you go to the clinics, you're going to notice it looks a lot different. You will be screened before entering any one of the buildings, so your temperature will be taken and you'll be asked a certain amount of questions about your health before you're entered into the building. Then when you're in the building, you'll notice that there are directional signs. The elevators are going to be limited to maybe no more than 2 people. There'll be up and down staircases, and there'll be arrows marking directionally where you should and can be walking when you're around campus. When you're in the buildings and when you're around people, you need to be wearing a face mask that covers your mouth and covers your nose. If you don't have your own mask, we'll give you a mask. As far as PPE goes, we have PPE for our patients as well as providers in the clinical areas. Conference rooms and, as I said, elevators are going to be restricted to numbers of people, as are our labs and classrooms eventually. We've also enhanced our cleaning techniques and our schedules to ensure that once people are in a room or a certain space, they're appropriately cleaned, so we are ensuring that it is safe as safe can be. All of our protocols are designed to obviously limit the risk of exposure that you're going to have. But frankly, COVID-19 is still very contagious no matter what we do, and you need to do your part to ensure that we're staving this infection. And that means, just like we've been saying all along, washing your hands frequently for a minimum of 20 seconds with soap and water, maintaining social distancing, and it's going to be difficult when you're seeing friends and colleagues that you haven't seen for a long time. You have to consciously think about staying at least 6 feet apart. And then most importantly, if you're not feeling well, don't come to the clinic, don't come to campus. Stay home if you're not feeling well until either you're screened or that you're better. We want to ensure that we're keeping everybody safe as we move through this. I got to tell you, I can't tell you how much we all appreciate the work that you've done and the quality of work that you've done remotely. It's been a really tough accommodation for everybody to make, but I think everybody's made it really well. Now that we're entering the yellow phase, it's exciting because we're starting to see some movement, but we still need to remain very cautious as we move forward. If you have any questions or concerns, don't hesitate to email either Brian Zuckerman, who I have designated as our pandemic safety officer, or feel free to email me. I'm happy to try to answer any questions that you might have or direct them to anyone who can help us out. So please, as we move forward into this next phase, which is going to be in front of us just in a few days, remain safe, I want you to be vigilant, and most importantly, I want everybody to stay safe.